Good morning. My name is Jennifer Berry, registered nurse pursuing a master's in nursing education. After observing a high-fidelity simulation, I truly believe that the acquisition of this caliber technology would be highly beneficial to our students, the institution, and the faculty as a whole. The use of Glockster and Animato will significantly enhance the learning experience in the classroom of our undergraduate nursing degree program here at ABC University. As a teacher for licensed practical nursing students, I taught them using simulations with mannequins, and the learners were very responsive and inquisitive. The mannequins provided an outlet where the learner had the ability to listen to various body sounds, and the mannequins were programmed to talk and to virtually respond to interventions performed by the students. It is no surprise, with the advancement in technology and global networking, that students spend more of their out of school time in the virtual world of internet and gaming. They build their own social groups, networking in areas of interest and researching on their own. This may not be always be the correct factual information when they research, but it is nonetheless forming the opinions and knowledge they retrieve for themselves. This shows how important it is to embrace the technology, welcome it, welcoming it into the classroom to guide and coach the students in learning the correct way of using online technology, teaching them the reliable and safe procedures of networking and researching. Innovative technologies and simulation in health professional programs helps educators and students meet the challenges of increasingly complex clinical practice and settings. Simulation has been used primarily to train nurses either in interprofessional teams or within their respective nursing training levels. Interprofessional team simulation promotes teamwork, communication, and professionalism. In observing the simulations, it was apparent that students not only appreciated how they can interact with the nursing role based on their current level of education, but also that they were able to see what students from other years in the program can contribute. Interprofessional simulation helps students adapt to a team environment where staff nurses of varying levels of experience and members from different job descriptions, i.e., occupational therapists, physicians, pharmacists, must work collaboratively, cohesively, particularly with unstable patients on or during critical events. Allowing students to work alongside other people representing different aspects of the healthcare team can enhance the students' sense of professional solidarity. Instituting the innovative learning tool called Glockster would greatly enhance the efficiency and communication between students and faculty. It is easy to get overwhelmed with the latest trends without knowing for certain that they will make a direct impact on our students. I chose this tool because it opens up a whole new way to incorporate innovative multimedia tools into your instruction. It can be used across a curriculum to add a grading rubric that is clearly visible to students. It also promotes collaboration and higher level thinking in that it instantly engages students with opportunity to showcase their learning across numerous platforms. It can be utilized in the event that students are assigned interactive projects like medication administration or umbilical cord prolapse. It would be very useful to show a large audience at once through an interactive blog. Another innovative tool that would be beneficial if incorporated into the nursing curriculum would be Animato. I chose this tool because it enables students to share their stories with peers and faculty through video. It encourages a work environment that promotes creativity, encourages discussion and problem solving actively, and makes room for personal growth. This would be particularly useful when students go out into the community and interact with clients and patients and want to document through video what they're experiencing. The high fidelity simulation is extremely valuable in that, as an experiential learning technique, simulation encourages students to link concepts, apply theory to practice, and make clinical decisions. It promotes communication, teamwork, delegation, priority setting, and leadership skills. Simulation on a wide ranging complexities enables students to be ready for broad and unique situations. What I observed was a cold simulation, trach suctioning, and identifying what is causing a patient's rash. It is very valuable to learn and make mistakes in this kind of setting and to receive formative feedback to immediately correct and solve the problem. Some benefits of using high fidelity simulation would be better communication, experiencing a realistic environment before actually going into it. And from what I observed on debriefing after the simulation, students and faculty can exchange ideas. Important points were reflected on where students identified areas that needed improvement. Simulations allow students to understand that their roles better. This technology is relevant to addressing cultural, economic, and social policy needs in that by the year 2050, it is predicted that minority populations will constitute half of the general population. This evolving population change is significant due to the overwhelming burden of disease that minorities face in the nation. Cultural competence training is currently being used to prepare practitioners to provide care to diverse populations in an effort to eliminate health disparities. In the nursing curriculum, patient simulation has been used mainly to teach the biomedical aspects of care with less focus on the psychological, cultural, and environmental context. The potential exists for the use of high fidelity patient simulation as an effective teaching strategy for cultural competence training. In conclusion, implementation of high fidelity simulation and innovative learning tools such as Glockster and Animato will greatly enhance and improve the way the students engage with each other face to face or digitally. Communication is key, and in order to achieve the highest standard in innovation, we must afford the institution with the finest levels of technology and resources to accomplish these goals. Thank you very much for listening.